Hello everyone, I'm Dr. Saurabh Dixit. So today I'm going to discuss with you why you should be a surgeon, why to take surgery as a branch, what is all that you need to know about surgery. So when we talk about surgeon, or let us take when we talk about doctor, being doctor is one of the most respectable profession, most noble profession of this world, but a surgeon has a respect also, and he has that flamboyancy. This is a branch which is not only full of respect, it is full of swag. When you wear those scrubs, you look the most handsome. No attire can suit you, fit you better than a surgical scrub. Let me tell you, there are a lot of students who ask me a question, sir, I love surgery, I love reading surgery, I love studying surgery, I get good marks in surgery. Should I be surgeon? But I am afraid of working for long hours, the lifestyle, the hectic lifestyle. Should I take surgery? Let me tell you, if you have a slightest of the doubt, then surgery is not the branch for you. You have to be passionate, you have to be obsessed about taking this branch. Let me tell you one very important thing. When you treat a patient, you get that gratification. But surgery is a branch where you get that instant gratification. Suppose you have a patient with peptic perforation, or suppose you have a patient with appendicitis, acute appendicitis, and you do a laparoscopic appendicectomy. The very next day you discharge the patient. The amount of gratification that you have got, that 24 hours before or 10 hours before, the patient was in deep pain, and now this is relieved. So the swag, the respect, the flamboyancy, the gratification, everything is enormous. Now the question is, a lot of students ask, so this is a huge, long, you can say tenure branch. You have to study for 6 years, 7 years, 8 years, and then you have a long, steep learning curve. Should I be taking? Let me tell you, this is a branch which requires utmost attention, utmost discipline, and utmost the top level of surgical skill. And to deal with that skill, even these 6 years are less. Remember, 5-6 years is nothing. But when you get yourself the degree of the surgeon, the things that you get in, you can say, as a reward, as a collateral reward, are, you can say, you cannot even think about that. Whenever we talk about surgery, a lot of students talk about the saturation. So this field is getting saturated. Should I be taking surgery, or should I be taking some other branches? Remember, where do you not see saturation? Everywhere, every branch. Even a fruit selling, if you talk about the vendors who are selling the fruits, they also have a saturation. If you talk about a plumber, you talk about an electrician, you talk about, every branch is saturated. When you talk about medicals, you can say branches, every branch is saturated. Remember, no one is immortal. The seniors will die. Unfortunately, don't take it me otherwise. Yes, but they have to be replaced. At one point of time, they will also retire. They will also, you can say, have to leave their position. And it is you who will take up that. And remember, if you're talented, you're skilled, no one can stop you. Now, the very next question that people ask is, sir, should we go for specialization, or should we not go for specialization? Only MS surgery is good. Remember, it is almost necessary to get a specialization if you are planning to settle in a tier 1 city. When you talk about tier 1 city, everything is ruled by the corporates. The patients are highly educated, and they search the Google the things, and then they come to you. And suppose they have even pain in the abdomen, they'll not go to a general doctor, they'll go to a gastroenterologist. So if you're planning to settle in a tier 1 city, you have to have that specialization. This is what is very, very, very important. But yes, if you want to settle in tier 2 cities, tier 3 cities, only MS surgery is going to do. But yes, even in tier 1 cities also, you can do an add-on fellowships. You can do fellowships in laparoscopic surgery. You can do fellowships in breast cancer. You can do a lot of fellowships in laser surgeries. And you can also establish yourself as a laparoscopic, or you can say a laser surgeon, or you can say a robotic surgeon. So these are very important things. But the first very important thing is that you should get the MS surgery done. Then there is a next question about the 6-year integrated course. Sir, should I go for a 6-year integrated course? I would say no, because not all of you are exposed to surgery. I will not say that it's bad, but you don't have an exposure. Suppose if you want to go for a 6-year CTBS or 6-year neurosurgery, and after 2 years you decide that this was not my branch, then you don't have a U-turn. And suppose if you at this point of time you want to be a cardiothoracic surgeon, and you are doing MS surgery, and during your residency you find that no, I want to go for a neurosurgery seat, I want to go for oncosurgery, so it becomes a lot easy for you in that case. So remember, try to avoid 6 years courses. When we talk about DNB versus MS, I would always recommend go for MS surgery, because in DNB, most of the high, you can say, corporate institute, they don't give you ample of chances to study, to learn. It's not about only cutting, it's about teaching also. The teaching is not there. These 3 years of your residency are the most important phase of your life. If you don't utilize them properly, you will ruin your life. Only getting a degree is not important. Learning is also important, and the third year or first year to 3 years, they're all very, very, very important. In a good corporate hospital, you don't have good teachings. Yes, you may have good laparoscopic surgeons, good surgeons, every department is there, but in a you can say medical college, the amount of, you can say, work you get, the amount of learning you get is it cannot be paralleled. The next, that very important thing is that, sir, how should I plan my residency? Residency are the 3 golden years, and there are 3 golden tricks: discipline and learning. This is one. So you should be disciplined and you should be learning regularly. The second is thing, stick to basics, and third is study from the first year. If you don't study from the first year, it becomes very, very, very problematic. Now the students ask a next question: sir, in residency I don't have lot of time. Yes, this is a fact. You have to learn. Then how shall we study? And remember, if you don't study, the eyes will never see anything which your brain doesn't know. So try to understand, start something from the basic cases that you see from day to day life. Suppose if you see a patient of peptic perforation, study the peptic perforation, study H. pylori, study, you can say, all the complication of the peptic ulcer disease or gastric cancers in that case also. So this is what is very important, and this is how you collect lot of topics. Like I've started a new endeavor, that is Surgery Dada, where I'm trying to organize such basic residency classes. Why? Because I myself have struggled with that. So I want that every day residents should come and I should teach them small topic. I take an evening live session. Why I take? It's very easy for me to record the course and just get away with that. No, but I take a 30 minutes or 45 minutes everyday evening class so that I can discuss one topic. I want to just create that ward-like effect, and that is what you should also follow. That residency is the phase you have to learn, because once you cross your residency, you'll never be able to learn these concepts again. So remember, surgery is a wonderful branch. You just have to be emotional, passionate, disciplined. And if you have these 3 things, yes, you are a surgeon. Yes, you are a surgeon.